This is the Community Health Assessment for Carteret County, North Carolina, Nursing Course 408, Fall 2017. The geographical area assessed was Carteret County, North Carolina, which is by the coast. It is bordered by the Pamlico Sound and the Atlantic Ocean. There are 11 municipalities within the county: Atlantic Beach, Beaufort, which is the county seat, Bogue, Cape Carteret, Cedar Point, Emerald Isle, Indian Beach, Morehead City, Newport, Pelletier, and Pine Knoll Shores. And if you look at the map in the lower right-hand corner, you can see some of those cities listed. The healthcare topic that we chose to educate residents in the county on is teens, and we will be educating them on opioid drug abuse. We chose this topic because Carteret County is the 7th leader of emergency room visits in the state for substance abuse, unintentional poisonings, and overdose. Our aim is to educate teens on the prevalence of opioid drug use in Carteret County, the repercussions of drug abuse, and resources for those who may need help. We first performed a windshield survey of the county. The boundaries of the county, as well as Beaufort, the county seat, include roads, highways, and water. You've got the two bodies of water, the Atlantic Ocean and the Pamlico Sound. You've got the islands, which incorporates Pine Knoll Shores, Indian Beach, Emerald Isle, and Atlantic Beach. And then you have the mainland, which has Morehead City, Newport, Cape Carteret, and Beaufort, which is the county seat, as well as the others that I listed before. The main housing for the county is apartments and townhomes, condos, houses, including the rental properties on the beach and on the mainland, mobile homes, RVs, and there is even some historic housing from the 1700s in Beaufort. The common areas that people of all ages go to are restaurants and bars, which, as you know, it's on the coast, so seafood is a big thing at the restaurants and the bars. Shopping and water sports such as scuba diving and fishing. Transportation includes private vehicles and taxis, the Carteret County Area Transportation System, and we also observed people walking, riding their bikes, and skating. The Carteret County Parks and Recreation Department is responsible for providing adult athletic and recreational programs. The stores that we observed, in addition to the local businesses, included Walmart, Big Rock Sports, Food Lion, Lowe's Home Improvement, McDonald's, and Lowe's Food, and these also constitute 6 of the top 10 employers in the county. While doing the windshield survey, we observed people walking and running with dogs, as well as vendors. The condition of the area was clean and free of debris, and there were no abandoned cars or houses that were observed during the survey. There were multiple signs that were available to the community and to people in the community, especially the hurricane evacuation route, which being on the coast is an important factor. Signs for Fort Macon, which is located just next to Atlantic Beach, and then beach access signs, which is important for the tourism industry. Caucasians make up approximately 90% of the people in Carteret County, followed by 6% African American. Hispanics make up 3%, and Asians make up 1% of the population. The 4 top religions in the county are Baptist, Protestant, Jehovah's Witness, and Catholic. The healthcare options available are Carteret General Hospital, which was named a top 100 rural and community hospital, and that's out of all the rural and community hospitals in the United States, and it was the only one from North Carolina in 2017. They also have doctor's offices and urgent care offices available, as well as a VA clinic. Republicans constitute the majority of the political atmosphere in Carteret County. You also have several media sources, such as the local newspaper, WNCT, which is a local news station, and American Media Production, which is a local small business. The business and industrial side of Carteret County includes agricultural products. There is a good bit of farmland in Carteret County. The top products are corn, soybeans, tobacco, wheat, hay, potatoes, cotton, poultry, and cattle. Manufactured goods such as fish meal, concrete products, clothing, roofing products, and jewelry, and of course tourism, especially in the summer months. There's also a historical park that is run by the Carteret County Historical Society, as well as the North Carolina Maritime Museum located in Beaufort. The average life expectancy during 2009 to 2011 was 74.9 for males and 80.5 for females. The average median family income was just under $60,000, which is slightly above the state average. However, Carteret County has a 15.2% poverty rate. A majority of the lower income households are from single women, and jobs tend to be seasonal, especially in the summer months, where unemployment decreases during the warmer periods and increases again after August. Carteret County has a lower teen pregnancy and infant mortality rate than the rest of the state. The leading causes of death are cancer, heart disease, and stroke. Obesity, drinking, and tobacco use are also very prevalent among residents in this county. Carteret County also is one of the highest numbers of prescribers per population. As we've mentioned before, Carteret County is one of the top counties in North Carolina for emergency room visits related to substance abuse, unintentional poisonings, and overdoses. However, a good thing is that violent crime seems to be decreasing overall in the county. We interviewed a key informant in the county, and he identified 4 issues that the residents in the county are aware of and are making strides to combat. The first is opioid and suicide risk. The second is income disparity. The third is access to health care. And the fourth is gentrification. First, we'll talk about the opioid and suicide risk. Carteret County was ranked 94 out of 100 counties in opioid abuse and overdose, meaning that only 6 counties had higher rates of abuse. Doctor shopping was particularly noted, especially in adults ages 21 to 45. And the community is aware and is concerned that the opioid abuse could escalate to heroin use and other illicit drugs. So the county commissioners recognize the need for a detox center. So the residents and the government officials know that this problem exists. However, they have not put a solution in place yet to address it, but they have identified what would constitute a successful implementation to reduce this opioid overdose and abuse. So they need to identify biologic and psychological aspects of dependency, prevent use and abuse in people that have not already started using, treat those who have already started using, and then enforce the law. The second issue was income disparity. As previously mentioned, the poverty rate is 15.2%. The largest demographic living in poverty are females ages 25 to 34, and approximately 85% of children receive meal assistance through the school system. So this is one of the hot topics in the county. They also want more access to health care. So 6 out of the top 10 employers only hire part-time employees, which means that those employees don't receive any benefits at all, healthcare benefits as well as retirement. So the community wants obviously more healthcare services available, especially mental and behavioral health providers, which would include substance abuse counselors, and they also want access to more affordable health care. Gentrification was the fourth issue that the key informant discussed. So basically the situation is that new homes, big homes, are being built in the county, not just at the beach, but also on the mainland, and it's increasing property taxes. So this is making the property taxes go up, not just for the people who are building these new homes, but for the people who don't have a high income. So there are three tiers as far as income disparities go, and it's done by county. So tier 1 is distressed, tier 2 is moderate, and tier 3 is least distressed. And Carteret County is considered a tier 3, which means it's considered least distressed because of all these new homes and remodeling that are done for the tourism industry. However, the property taxes going up means that natives, people who live there year-round, their property taxes are going up, and so they have less income for healthcare and the rest of their life. The population in 2015 was just under 70,000 people. 51% of those were female and 49% were male. The largest employers were the Board of Education, the Carteret Healthcare System, county government, Walmart, community college, Big Rock Sports, Food Lion, Lowe's Home Improvement, McDonald's, and Lowe's Food, which we've already talked about some of those. We will now move on to our community health diagnosis. The community strengths that we saw were that the community has awareness of the opioid crisis and wants to do something about it. The community programs available to its residents. It is a very safe community and it has a very good school system. Some of the programs available are listed here. You've got the Hope Mission Ministries, which provides meals and shelter, Bridges Down East, an after-school program, and Loaves of Ambition, which is a religious-based drug treatment program. You also have veteran services to assist veterans with benefits, disability, education, and housing. You also have the public transportation system, which stops every 3 blocks and travels the same route every day of the week. There's also the Leon Mann Junior Enrichment Center, which is helping older adults promote independence in their lives. And then if you're over 50 or over 60, there's additional incentives within the center that are available. Pardon me. The weaknesses that we identified were mental health, including drug abuse and use, and the community not working together to try to combat the issues, and income disparity, as well as access to healthcare. The priorities identified by the community were to address the substance abuse issues, chronic diseases such as heart disease and cancer, and access to healthcare. We diagnosed the community with having ineffective coping, and a few of the identifying characteristics are abusive chemical agents such as alcohol and drugs, change in usual communication patterns, destructive behavior towards self or others, fatigue, high illness rate, inability to ask for help, inability to make decisions, inadequate problem solving, and sleep disturbances. Our nursing interventions will be to educate teenagers about negative outcomes of drug abuse and how to prevent abuse, screen those who may already be abusing drugs or those at risk, and connect those with drug abuse problems to available resources within the community. In conclusion, with the rise of drug abuse in Carteret County, it is imperative that we educate the community, especially the adolescent and teen population, on ways to prevent addictions, overdoses, and deaths related to prescription drug and opioid abuse. Education, screening, and community resources are essential in order to tackle this crisis. We've learned that the drug crisis is much more severe in Carteret County than originally thought, and in our future nursing practice, we will be able to recognize the causes and effects of drug abuse in our patients and better address them. We hope to become better advocates for those at risk within our individual nursing practice.